Alberta recorded 2,048 new cases. That is a new record daily high. There are now more than 21,000 active cases. That is also a record high. And we are now seeing a lot more people being hospitalized. Kathy Lee is at Foothills Medical Centre tonight. And Kathy, we've learned Alberta Health Services is getting ready to prep doctors to make some heartbreaking decisions.
Very heartbreaking, Tara. A meeting is scheduled tomorrow for doctors and for healthcare providers to discuss a triage plan. And this is to determine which patients will get life-saving care and which will not in the event the ICU and the hospitals become overwhelmed. I spoke to an Alberta physician and he says if that day should come, Tara, it will be devastating.
There are now 151 people in the ICU in Alberta. This was the peak during the second wave. The Premier says we have enough capacity to deal with the surge. Earlier this week, Jason Kenney announced major surgeries in Calgary and Edmonton and the North Zone would be cut back to make room for COVID-19 patients. Dr. Dina Hinshaw says Alberta Health Services is implementing additional temporary surge capacity measures.
These surge measures are similar to those put in place during the first and second waves and include postponing some non-urgent scheduled surgeries that require a hospital stay.
We are already looking at getting staff from surgical positions and opening surge units in preparation.
Some Alberta physicians are now warning of a healthcare system collapse if numbers keep rising. CTV News has learned a memo was issued over life and death decision making. Alberta Health Services is calling for a meeting to discuss the province's critical care triage framework. That's a guideline to determine who gets life-saving care if demand for critical resources exceeds availability.
Whether they have COVID or whether they're a massive trauma or a big stroke would be admitted to the ICU, but we only have one bed left. These kinds of documents outline a process by which we can decide, and it's a terrible decision to have to make, which of those three patients would actually get the last ICU bed or the last ventilator.
In Ontario, where more than 800 patients are in the ICU, doctors will soon have to make a tough decision on who gets aggressive treatment. Its new triage system will go into effect as the number of occupied beds gets closer to 1,000.
I worry about the toll that this is going to take on our frontline staff, having to make these decisions, having to deliver this news to family members.
Physicians here say the upcoming triage meeting is concerning. Kathy Lee, CTV News, Calgary.